Now we're going to demonstrate an eccentric hamstring release. When we think of the hamstrings, they are a critical part of the posterior kinetic chain of the body. So when we think of all the musculature and connective tissue running up the backside here, they're right in the middle, connecting the upper body to the lower. Now, the hamstrings act as hip extensors as well as knee flexors. And if you've assessed the patient and you've found some restrictions that you want to release, we have found in clinic that by having the patient perform a hamstring curl with a bit of resistance from some rubber tubing or TheraBand and getting in there and actually treating and releasing the hamstrings during the eccentric component of that exercise, you can get a much more effective release and really free up the posterior kinetic chain. So when I say eccentric, basically I mean the hamstring elongating under tension. So there's a bit of tension there, and as it's elongating, we're going to get in there and release some of the structures. So we've got Mickey helping out once again. We've got our prone here. We're going to bring the leg up to about 90 degrees, and as you can see, there's some rubber tubing here to give us a bit of tension. How's that doing? Okay?
Yep, good.
So you want to make sure it's resistance that the patient can handle. Okay, so just perform one curl here so we can see. Perfect. Okay, so we're going to bring this back up to 90. I'm going to use a closed hand technique, and we're going to get right where the hamstrings attach at the ischial tuberosity. Doing okay?
Yeah.
Yeah, and now we're just going to have you move the leg into extension. Good. Or the knee into extension, and now bring it back. Good. And once again, there we go. Doing okay?
Yeah.
Good. And we'll just do one more. There we go. And as I move down, now I'm going to switch my contact here. I'm going to go to more of a thumb contact. There we go. How does that feel?
That's good.
Good. And as you're moving down the hamstrings, you're feeling for restriction, and you can move a little more medial to get on the semimembranosus, semitendinosus. And right down here where the muscles are starting to bifurcate, I can even move a little more lateral and get on the biceps femoris. I was actually feeling more on the medial hamstrings than the lateral. Is that what you felt?
Yeah.
There's definitely more restriction there. Good. There we go. Good. And relax. So just a great way to release the hamstrings.